Good morning. My name is Peter Mavrelis, and my associate is Dr. Ahmad Shaguri. We're here at St. Mary's Hospital in Hobart, Indiana. We perform transoral incisionless fundoplication procedures to treat GERD. This morning, we're going to be treating a 71-year-old woman who's had a long-standing history of heartburn and GERD symptoms. She cannot tolerate PPI medications. She was offered either a surgical treatment for this GERD or our new transoral incisionless fundoplication procedure that we're going to be doing this morning. Dr. Shaguri will now explain the procedure and how we do it.
So, as you're going to see in the following video, this approach is incisionless and transorally. It mimics the surgical approach, but without incision. So as you're going to see in the following pictures and video, this is a valve that was dysfunctional, was not working properly, and with this approach we are able to create a more stronger valve that's about 3 centimeters in length and about 310 degrees in wrap.
This is a picture of the valve before the TIF procedure. We're preparing the esophagus device for introduction into the patient. We're placing the gastroscope with the esophagus device into the patient's esophagus. This shows the distal esophagus as we're entering the stomach. This shows the esophagus device entering the stomach. We're now going to retract the gastroscope and free up the tissue mold so that we can begin the fundoplication procedure. This shows us closing the tissue mold and bringing the gastroscope around to obtain a better view of the fundus of the stomach. We're using the tissue retractor to lengthen the GE junction, and we'll use the tissue mold to wrap the fundus of the stomach posteriorly around the esophagus. We're securing the fundoplication procedure with 4 to 8 polypropylene sutures in the posterior position of the stomach. This shows us reloading the sutures into the esophagus device. We'll then remove the tissue retractor and turn our attention to the anterior portion of the stomach. After re-engaging the tissue retractor, we rotate the anterior portion of the stomach around the distal esophagus, removing air at the same time, creating the fundoplication. Once again, we're placing 4 to 8 fasteners 1 centimeter above the Z-line on the anterior side. We're now placing the tissue retractor along the greater curvature of the stomach, and we're going to lengthen the valve and place 4 more sutures. This will end the procedure. At the end of the procedure, we remove the esophagus device. We then rescope the patient to ensure that there's hemostasis following the fundoplication. We can see the distal esophagus, and then we can see the valve before the procedure and then after the procedure.
What's unique about this approach versus the surgery, that certainly it is much less invasive, but also it does not have the long-term side effects such as dysphagia, which is the trouble swallowing, and gas bloat syndrome, which a lot of patients get annoyed by after surgery. The recovery is fast, and
the procedure was done here at St. Mary's Hospital. The patients are put completely asleep with general anesthesia. The procedure takes about 1 hour to perform, and the patients stay overnight. They then are on a full liquid diet for about 2 weeks. They stop taking their PPI medications after. We have an 80% success rate at getting patients off their PPI medication. If you're interested in finding out more about this procedure, call us and make a consultation with us at the number below. Thanks.